Have you ever noticed that your knee doesn't hurt as much while you're moving, but the moment you rest, the pain seems to creep in? You sit down, relax for a while, and when you try to stand again, your knee feels stiff, sore, or even unstable. That can be confusing. Rest is supposed to help pain, not make it worse. But when knee pain feels worse after rest, it's usually not random. It's your body reacting to something deeper that most people never have explained to them. The knee is part of a system that depends on constant communication between muscles, joints, nerves, and circulation. When that system stops moving for too long, even short periods of rest can trigger discomfort. One of the biggest reasons knee pain worsens after rest has to do with joint lubrication. Inside your knee is synovial fluid. This fluid acts like oil in an engine. It cushions the joint and helps cartilage stay nourished. But unlike oil in a car, it doesn't circulate on its own. It needs movement. When you sit or lie down for long periods, that fluid becomes less evenly distributed. The joint surfaces dry out slightly. Then, when you stand up and put weight on your knee, friction increases. That's why the first few steps can feel painful or stiff. Another factor is muscle deactivation. When you rest, key muscles that protect the knee start to relax too much. The quadriceps, glutes, and stabilizers around the knee essentially go offline. When you suddenly ask them to work again, they're slow to respond. That delay means the knee joint absorbs more force than it should during those first moments of movement. Over time, this repeated stress can irritate tendons, strain cartilage, and increase inflammation. Rest also affects circulation. Blood flow slows when you're inactive. Less circulation means slower delivery of oxygen and nutrients. Waste products linger longer. This creates a stiff, achy sensation when you try to move again. For many people, this is most noticeable in the morning. You wake up after hours of rest, stand up, and your knees feel tight or painful. After walking around a bit, the pain often eases. That's not a coincidence. Movement is literally rehydrating and reactivating the joint. But here's where many people go wrong. They interpret that pain after rest as a sign they should rest even more. So they avoid movement. They sit longer. They lie down more often. And they train their knees to become more sensitive to inactivity. This creates a vicious cycle. The less you move, the stiffer the knee becomes. The stiffer it becomes, the more uncomfortable rest feels. Eventually, pain shows up more frequently and lasts longer. Another overlooked issue is alignment. During rest, especially sitting, posture often collapses. When you stand up from these positions, your knee may not be aligned properly to handle weight efficiently. Even small misalignments can dramatically increase stress on specific parts of the knee joint, contributing to chronic pain. Pain medication may reduce symptoms temporarily, but it doesn't address any of these underlying issues. The lubrication problem remains. The muscle weakness remains. That's why pain often returns the moment the medication wears off. What the knee truly needs is not endless rest. It needs smart movement. This means gentle, frequent movement that keeps the joint lubricated, muscles engaged, and circulation flowing. Simple habits like standing up regularly and waking up stabilizing muscles can dramatically change how the knee feels after rest. Extra weight increases pressure on the knee joint, especially during the first steps after rest. Supporting overall health and reducing unnecessary joint load can make those first steps feel smoother and less painful. The key takeaway is this: pain after rest is not a sign your knee is broken. It's a sign your knee is underprepared for movement. When you prepare it gently and consistently, the pain often decreases. If your knee feels worse after sitting or sleeping, don't ignore that signal. It's your body asking for better support. You don't have to accept stiffness as your new normal. Sometimes the path to less knee pain isn't more rest. It's better movement.